This episode is brought to you by Wagon Maker and Oberle. Wagon Maker and Oberle has been providing legal counsel to nonprofit organizations for over a decade. Their practice is founded upon commitments to deliver high-quality work product and a transparent billing process, to treat clients with integrity while faithfully advocating for their best interests, and to strengthen the nonprofit sector by fully engaging with the communities they serve. To learn more, visit wagonmakerlaw.com. You're listening to the IndeDocs podcast, where we discuss important issues related to our mission to preserve, promote, and protect the practice of independent medicine. Thank you for tuning in.
Welcome, everyone. I am Dr. Eveline Waring, and it is my pleasure to moderate this IndeDocs podcast entitled Women in Medicine. I'm thrilled to have so many amazing women participating in this podcast. A quick disclaimer, we are sharing our personal opinions based on our own experiences. Nothing should be taken as professional legal, financial, or medical advice. I'm going to ask each physician to introduce herself briefly, and then we are going to dive right into our content. The bios of all of our participants can be found on our IndeDocs webpage.
I am Dr. Piave Pitisci Lake. I am a general psychiatrist, and I have been in practice since 2002. And I've always been in private practice, and I specialize in women's reproductive health. So women who are having mood issues related to hormonal changes, pregnancy, postpartum, menopause, PMDD, things like that.
My name is Dr. Emily Darr. I'm a board-certified physical medicine and rehabilitation specialist. That's a long name for I do interventional pain management. I take care of various orthopedic issues and pain in general, restoring function to people. I've been practicing since 2011 when I finished my training from University of Virginia. I am currently in a private practice with 8 other physicians who do orthopedic surgery and sports medicine primary care.
My name's Dr. Joni Mazza. I am a dermatologist in Charleston, South Carolina, co-founder and owner of a practice called Mara Dermatology that's located in Mount Pleasant, South Carolina.
I'm Dr. Fiona Rahbar, and I'm a board-certified dermatologist. And I also co-founded Mara Dermatology with Dr. Mazza, and we specialize in general medical dermatology, cosmetic dermatology, as well as some surgical procedures as well. Interestingly, I'm just coming back to Charleston. We were away for the last year and a half on a highly recommended sabbatical from my non-compete. So we were more recently in South America and Asia, lived in Mexico for a bit, and now back home in Charleston.
Thank you. So let's dive into our first question. What differences have you experienced as a woman in medicine that you believe are distinct simply because you are a woman?
So I'll go ahead and try to answer that. So these things come out of my own experiences and out of my own pregnancy. And so those are obviously what I've experienced as a woman that I think men are not going to bring the same kind of interest or experience to it. Not that they can't be good at it, but that is why I got into the specialty that I did. I would say the other thing is being a mom. And it's hard to know where temperament and sort of gender roles come into play. But my husband is also a physician, and we decided he would work full time and I would work part time to accommodate the kids' schedules. So that's what we've done. So my working part time, I think, is very specific to being a woman, being a mother, and wanting that role in addition to being a physician.
Thank you for that. Anyone else want to crack at that top question? Dr. Darr, you have a thought.
So, I work in orthopedic surgery, which is predominantly male-driven. I don't know what the statistics are, but there's a lot more men than women. So being a female physician in that category, I get not necessarily dumped on, but a lot of the female specific issues get sent to me. So I have come to accept that, and I take that and I run with it, and I like to help as many women as I can. So then, like she was saying, I use my own experiences. So now that I've had children, I have two, and postpartum issues, and taking those issues even further. So, for instance, if a patient comes in and has low back pain, or we've done physical therapy and there's pelvic instability, et cetera, not many people, especially if they're males and haven't had babies, think about the pelvic floor and how important the pelvic floor is to our quote core stability. So I'm not afraid to dive into the, hey, do you have a little bit of stress incontinence? Are you experiencing these things? Do you have pain when you have intercourse? Those are all things that can be contributing to back pain, can contributing to, hip weakness, hip pain. So sending them to a pelvic floor physical therapist, even having the conversation with female patients, I think is important given my experiences as a female who's had children and has been in this male dominated field, and not being afraid to approach those issues.
It's really nice to hear that that's a different approach and makes patients feel welcome, especially I think when it comes from another female, honestly.
Yeah.
In your opinion, what particular stresses affect female doctors more than males? This is a big, open, wide question.
I think we as women physicians wear a lot of hats, especially when we are independent, meaning we have our own businesses. So not only are you a physician, right, which has its own responsibilities, and as business owners, which is a separate part of the Venn diagram. And then, a lot of women choose to be mothers. And so I find that some of my colleagues, including my husband, right, who is also a physician, when he's a physician, he gets to wear his hat that he's a doctor and he's the doctor. But I find that women tend to need to wear more hats than the men, not in a good or a bad way. It's just that even though I work full time, I still coordinate the play dates and I still coordinate the school events, and all the emails still come to me and the texts come to me. And in some ways, I mean, I won't lie, I like it. I want to be involved. But I do find that amongst my colleagues, both men and women, that the women seem to have more hats that they need to juggle.
I call them the hidden burdens of being a woman in general. They pop up every day.
Ooh, the hidden burdens. Okay. That leads me to our next question. How has your practice been shaped by your own individual experiences as a woman? I think, Dr. Lake, you were kind of starting with this, and maybe you can lead off with this question.
Sure. So when I was in my residency, I wasn't necessarily interested in women's mental health specifically. And it was just starting to come online with other psychiatrists interested in women's reproductive health. And so it was very new. We didn't have a rotation in it specifically that was required of us, even though we could do it if we wanted to. And during residency, I tried to conceive, tried to get pregnant. I was in my late 20s, early 30s, and we had just gotten married, and it wasn't working. And so I was thrust right into infertility treatment right at the beginning of my early career. And that had a profound impact on what I became interested in. And obviously my experiences just as a person, as a woman, experiencing difficulties getting pregnant and what that means and what kinds of things that means for other women going through it. And I think it's allowed me to ask questions in a different way and to, I think, connect with people in a different way because they can get a sense that I know I've been there before.
So establishing empathy.
Yeah. And I think just that, that connection that you can recognize kind of a fellow traveler, if you will. That's, I think, even a little bit more in addition to being a doctor.
Well, it's lovely for a patient to have that opportunity and have the sense that they're heard and understood in a fundamental and foundational way. That's wonderful to hear. How does everybody else feel about that question? Anybody else want to take it on?
Yeah, gosh, I could answer this question in a lot of different ways, but what keeps coming to mind is that when I went to medical school, I did not go with the intention of becoming a dermatologist. I absolutely thought that I would go into women's health, become an OBGYN. I've always been very passionate about women's health, But I didn't go to medical school until I was 26. So my years of medical school and residency training all took place between the ages of 26 and 34, which was the exact time when I was getting married, thinking about starting my own family. In fact, I had my first child when I was an intern. And I think that, my decision to pursue a career in dermatology was largely based on wanting a schedule that allowed for me to have a family. So I think that is something that women are constantly, having at top of mind when we're making career choices that maybe our male counterparts are not considering to the same degree.
That's a pretty perfect segue into my next line of questioning, which is actually kind of a three-part thing. First, starting out generally, and then getting a little bit more expansive. So the questions are three parts, and here they go. How does having a family determine, if any, the trajectory of your career? In other words, might you have chosen a different practice model had you not encountered the demands that accompany motherhood? And do you think that women start out in one model and then transition into another model after the children leave the nest? This is a question that kind of takes us through our career choices, why we do what we do, how we do them, and when we throw it all out the window when our kids leave. What do we do? What makes that different? And who's experienced that? I mean, has it changed the way that you've decided what you're going to do with your career? Any takers?
I think I may be the only, well, other than you, Dr. Waring, my children are now 20 and 22, so they have sort of flown the nest. And my trajectory is different now than it was then. And I'm a serial plotter. I tend to like to focus on, one thing or one or two things as much as possible. And so thinking about how was I going to do women's mental health treatment specifically requires a lot of connecting, a lot of being around, being outside of the home and making other business connections, other doctor and professional connections that I didn't have the bandwidth for when my kids were a lot younger. And so now that they are, kind of off on their own and I have more space, more energy, I am starting to think about how can I tailor my practice? How can I make this into something that I've been thinking about for literally the past 20 years? And now I have some space, some time, some energy to focus on those goals.
And wouldn't you also say, Dr. Lake, that you were very involved in community efforts, national efforts? You're involved in all kinds of advocacy roles, are you not?
Yes, I am. And, it's interesting because we think about a little bit of like when you get out of the preschool years, your life is going to be a little bit easier and you've got more time, which is true. So when my kids were about 7 to 10, I was able to be part of an executive board for the mental health professional group of the American Society for Reproductive Medicine and lead some of the changes that we were trying to make within that organization. And I did find that those 7 to 10-year-old years were kind of ideal because my husband could do a lot with the kids and I had some time and space to do those things. But it was after hours and it was in the evenings. And the kids now make a joke with my husband about when I'm talking with my voice loud because we were on phones, we weren't on video or anything like that. The kids would ask my husband, "Is mommy on a loud phone call again?" I'm like, "Yeah, I'm on a loud phone call again." So
Funny. How about anybody else? I mean, you all are young physicians with young children. So maybe Dr. Lake and I are just talking about things you're dreaming of. I say that, and our dermatology friends have already recreated themselves and have branched out and have started an independent practice with young children. So taking what Dr. Lake said, she and I both sort of expanded our models and our opportunities after our children were a little older. So you dermatology maidens are really branching out at a very bold age, but you all are very intentional. You have started a practice. It's an independent practice. It's an interesting model. Can you speak to that and how you had the bravery to do that at your young age with young children. I'm really interested in knowing what your thoughts are there.
Yeah, I love that, Dr. Waring, you said brave, because that is exactly what I want my children to see. And it's not necessarily that I have to be more brave than anybody else, but I want them to see that women can be successful, women can be strong, and that we can work hard and accomplish big things, and we can do things for ourselves, for our families, and for our communities. And I would say for myself that I am the primary earner or the primary worker in our family now. And I want our kids to see that that's a possibility as well, that it doesn't have to be a traditional model, that they can grow up and they can be whoever they want to be, and they are able to do whatever they want to do, especially sometimes in medicine now. I know it's changing, but it can be a male dominated field depending on what specialty that you go into. So I really, part of me being, quote, brave is wanting to set a great example for my children so that they can have confidence and they can be strong in what they want to do. And as far as, being young, I mean, I don't feel terribly young, but I am 42 and starting a new business. There's definitely days where I wish I'd either started earlier or started later. Having kids that are 7 and 10, there's a lot going on that we try to be very involved with my kids. And so, you're like the hats, we're always split in different directions. But I think what really drove us to do something different is that, and I stand by this, I said this before, and I stand by what I say, is that medicine now is not what we chose to go into when we were going through medical school or thinking about being doctors. We had this vision, or at least I had this vision of helping people. I started out in business, and it was cutthroat and it was intense and everybody was out to get each other. And I said, no, I want to be warm-hearted and help people, and being a doctor is the way to do it. And now flash forward nearly 20 years, it's become about volume. It's about production. It's about getting people through the door. And I feel like that's not the intention that we started medicine with. It's not why we skipped out in our 20s when everybody else was partying. We were in the library studying. We took on hundreds of thousands of dollars of debt. And it's not that we wanted to see 70 patients in a day. That was not the vision. And so that's why we created Mara Dermatology, so that we can practice and we can be those doctors that we wanted to be 20 years ago when we started this whole endeavor. And I know you said the model is different. It's what we've found to allow us to spend more time with our patients, to be available for our patients, to have the bandwidth both to be present and patient with our children, and also present and patient with our patients. So, it's new and it's different. I think it's taking place around the country, but certainly in Charleston, it's something a bit uncharted territory.
I didn't know that about your business background. So in your bravery, which is 100% laudable, do you think that having business background gave you a little bit of confidence and a leg up in doing this different practice model? What do you think about that?
Yeah, I was horrible at business. This is why I left. I was at a school in the Northeast. They were so cutthroat. The first day they asked me what my SAT scores were. I mean, they weren't sharing notes. I mean, this was not my place, and I bombed economics. And, I knew that from the beginning that business was not for me. And I'm very kumbaya, holding hands, like I'm kind of woo-woo. And yeah, I mean, business just wasn't for me. So that's why we did medicine. But it kind of evolved. I've done private practice. I've done telehealth. I've done academic medicine. So we've tried different things. And I think this is the way that I will be able to happily, hopefully, practice for a long term. Because I know that rapid fire kind of model it worked for me when I was 25. But as you all know now, I am no longer 25. So I have to slow down.
That's fantastic. Dr. Mazza, you're in the hot seat, lady. You got anything to add to that? Because that was some good stuff.
She is amazing. Fiona Rahbar is amazing. I'm blown away by that answer. So I just want to say, yes, I second everything that she said. But as the word bravery kept coming up, I was sort of laughing in my head, thinking like, oh gosh, like my word that keeps coming to mind is like fear. This whole experience did not feel like it was coming from my bravery. It was a little bit fear-based and still is. And the fear for me was to work for 20 more years in a way that just wasn't feeling right or good. I didn't want to look back and say, gosh, I wish I had done this. When Dr. Rahbar and I had that magical idea that one time, like, why didn't I just go with it? Didn't want to look back and have regrets. And so we went for it. And it is brave too. So I agree. And then the other thought for me is, I'm 46. My children are 14, 10, and 6. So I have had a baby every 4 years. And when I made the decision to leave my academic medicine career, my son was 4. And so I sometimes think that this new practice is sort of like my 4th baby, right? Every 4 years, I like to just like flip my life upside down. And so here we are. So I'll let you know what happens a few years from now. Hopefully I'll just get a puppy or something.
It's so funny you say that. That's exactly, I was thinking the other day. I was like, this is just another baby. And then when you have a baby and they give it to you in the hospital and they let you take it home, oh my gosh, why would they do that? And then you go, I don't know what to do with the baby. And you just have to do it and you just have to figure it out. And so I feel like this Mara Dermatology is now our baby. Someone's letting us take it home and we're just going to figure it out how to keep it alive.
That's awesome, ladies. Dr. Darr, you are not out of the hot seat because we're talking about bravery, and every single female physician on this call is in a predominantly female field, except for you. You had the bravery to go where no woman goes before, which is the practice of orthopedics. And so, I mean, you're a physiatrist, right? So you're not in the OR. How did you ever think that orthopedics was the thing to do? How was that attractive to you? I want to hear about your journey.
Well, you hit the nail on the head. I grew up playing sports in the Midwest. I had to get out of that frozen tundra somehow. So I got a scholarship to play volleyball at the College Charleston. So here I am, 3 shoulder surgeries by the time I turned 18, redshirted my freshman year because of my 3rd shoulder surgery. And in hindsight, all 3 of those were totally unnecessary, done by, male orthopedic surgeons somewhere else that my mom took me to. She's complaining her shoulder hurts, blah, blah, blah. So I thought, you know what? This is not how a young female athlete should be treated and go through this system. There's got to be a better way. So I made it my mission. I was going to do well in school and become a sports medicine physician. I thought the only way to do that was to become an orthopedic surgeon. So I studied abroad in South America when I was in college. I followed around an orthopedic surgeon down there. I came back. I did all my volunteer work. I basically schmoozed a bunch of orthopedic surgeons so that I could get into the boys' club somehow. So get into medical school. I didn't even know you had to do a residency in anything when I got into medical school. And I'm sitting around with my gross anatomy table mates, and they're all talking about what they're interested in, what do they want to do residency. And I was like, I'm going to be an orthopedic surgeon. And they're like, ooh, that's like 5 years of residency and a year of fellowship. And I'm like, what are you guys talking about? So joke was on me, but I was already locked in at that point. So I started attending grand rounds, doing all the things, waking up at 4 a.m. And then 3 of my classmates were interested in this PM&R field that I knew nothing about, never even heard of it. They didn't have any physiatrists at my medical school. My mother then went to a physiatrist back home for chronic leg pain. And so I Googled it. And I found this website. PM&R stands for Plenty of Money and Rest, sort of like a unicorn. And it must have been written by an orthopedic surgeon because they were very bitter. So I looked into it and I said, well, this field is for me. I love money and rest. Of course, I'm still waiting for that to come around. But I did an away rotation at a university in the Midwest. And all of these people, there was women, number one. So I had looked everywhere at my medical school for like a female mentor or something. You just couldn't find one. So I found these physiatrists. They were awesome. They were active. They were talking about what they were doing on the weekend with their families, going out hiking, etc. And I was like, these are my people. Then I had to do my last rotation in orthopedics at a hospital in the state of South Carolina. And I remember being on trauma call, and the traumatologist comes in at 4 a.m, and we're all there, bags under our eyes. And he was just so excited. He's like, "Oh, thank goodness you guys called me. My kids are killing me. My wife is nagging me. And I just want to be here in the OR." And I thought to myself, I don't even know where this guy's coming from. This is insane to me. That is not me. So I was like, I'm not an orthopedic surgeon. I'm a physiatrist. I switched my application, applied to physiatry, and I was PM&R all the way. It stands for Physical Medicine and Rehabilitation. It is an amazing field. You feel so fulfilled. You just have to make one person's life just a little bit better. And that's something like adjusting someone's cane height so they're walking a little better. I mean, the little tweaks that I do every day make a bigger difference than somebody who goes and gets a knee replacement surgery or a shoulder scope. It is so fulfilling to me. So I finished my residency. And I also was thinking in my head, when you're 24, 25, whatever, in medical school, oh, I can do that. I can work 80 hours a week. I can be in the OR all weekend. But no, then you graduate, you're in your late 20s. I hadn't even dreamed of having a family at that point. But thank goodness I thought ahead. And then as I got into a more banker's hour specialty, I was able to do that. Of course, then I married an athletic trainer who worked in professional sports. So 8 months out of the year, I'm like a single working mother. So when I got out of residency, I took an academic position because I figured there's no call. I've got good hours. I can manage that. Great. It was great. I could do my own thing, I get home, but I was missing something. So I had dreams of doing it myself, setting up my own business, doing a private practice type thing. But I was scared. I had that fear. I was not brave. And I was realistic that, like, if the air conditioner goes out in my private practice in the middle of the night, I've got two young kids at home. Mine are 9 and 11 now, but back then, 1 and 3, 4 and 6, there was no way. So I took a job with the private group just so I could have more peace of mind and still do something more private and sort of set my own schedule. But even now, I'm wishing that I had more time to do more, because on the side, before I went to medical school, I sold real estate. So I love buying old houses and fixing them up and flipping it. And there's just not enough time in the day. And as I'm getting older, I'm 45 now, it's just, I can't do it all. So I have to pick and choose. And now I've got kids who are middle school age and elementary, and I just emotionally more needy, and I'm feeling so guilty. So a lot of the theme of this is female doctor guilt about treating more patients, seeing more people, fitting more people in your day. But the kids, you have to remember, the kids are your number one priority. And I just feel guilty that I don't give enough time. So my practice now, I start at 9 o'clock so I can do an hour of physical therapy to keep my body in shape to stand all day and inject people's backs. And then I get off by 3 o'clock when the bus drops them off. And then my second job starts, cooking them dinner, helping them with homework, getting ready for bed, going to bed. And then where's the time for me? There's zero. The weekends are for me, but then you have to take your kids to all these practices. So it's nonstop. I definitely chose my specialty based on being a woman, but then I had to cater to the added hidden burdens as you go through your career.
I think that what you're describing is creating boundaries, right? Is Dr. Lake, it's your field. Are we creating boundaries here?
We definitely are creating boundaries. And what I was thinking about, some of what we were going to talk about, and the idea of, what do we tell other women who are, in this field or who are coming up behind us? And what I would say is to own it, to really, yes, you are creating boundaries because you are deciding what's important to you. And whatever is important to you, it is okay, it is acceptable, and you can make that decision for yourself. And I know it's difficult, but you can make those choices to be able to say no, to be able to say, I'm going to have these hours because this is important to me right now. I think one of the issues sometimes is how much outside help do you have with the kids? At what ages? Do you have a nanny? Do you have someone helping you? And that can be another part of the whole, the whole guilt. But yeah, creating those boundaries, deciding what's important to you and how you want to pursue it, and doing it unapologetically.
That's some great wisdom and some affirmation. I think we can all benefit from that. Now I'm going to drop a little bit of a bombshell, and it goes a little something like this. Do you think you are treated equally compared to your male counterparts? If so, how? If not, why not? Who wants to take on that question first? Oh my goodness, does that mean you want me to start? Oh, okay, call on me. All right, Dr. Waring, what do you think? Well, I think it's very interesting that if you simply Google up the salaries and compare male salaries to female salaries, you're going to get a discrepancy it's going to go either 18 to 28% less for our people than for men. So I'm going to start with economic inequities. So we are not paid equally. And some people think that's because of the specialties that we choose, but there are lots of reasons for that. So I'm just starting with an economic issue. What else do we think? I'm sure everyone can chime in on this one.
Okay, I will take this one. To Dr. Lake's point about boundaries, that is something that I struggle with. Just to tell people no, especially I think Dr. Mazza and I both maybe do a little bit of this where we sort of treat our patients like we treat our children. And we have a hard time saying no if they want to come in on a Friday, if they want to come in on a Saturday, if you want to come in early or evenings. Right? We really want to try to accommodate everyone. And I feel like my male counterparts, at least in our specialty, had a much easier time of just saying, no, I can't do that. Whereas my response is either an automatic yes, or if not a yes, it's a, well, maybe let me try to figure out how to make that happen. How to figure out how to make that a yes. So, and I think that my no's are not as well received as maybe other male counterparts.
So to understand what you're saying, you are more accommodating is what your theme is.
Yes.
More accommodating. Let's see what else we got out there.
I guess to piggyback on what Dr. Rahbar had said, there are definitely times when I second guess a lot of my decisions, not medical decisions, but sort of business decisions based on this strong desire to be nice or to people please. So an example that happened recently was I was seeing, I have these patients, they're a married couple. I've known them for a few years, and the wife had an appointment for a procedure. She was in the office for about an hour. And while she was there, her husband had asked me, oh, hey, can you look at a few things and maybe treat this and treat that? And so sort of on the fly, I did that. And I wound up spending the next 12 hours internally going over, do I create a chart? Do I bill him for the visit? Do I do it as a courtesy? Do I bill him for the visit? Was it just something nice to do for these patients I've known, or should I treat this, add him on medical encounter, send him a bill? And, just that internal monologue all day. I don't know that, I don't know that many other people would do that. And I don't know if that is a female versus male thing, or maybe just my thing, but it's definitely something that comes to mind. And the craziest part of this whole story is that the patient himself said as he was leaving, oh, feel free to send me a bill for that. And the bill I would have sent him was $75. So I spent 12 hours thinking about $75 and whether or not it would be nice of me to not bill that.
I think that every woman listening to this struggle would join me in suggesting that you are a highly trained, board-certified dermatologist who deserves every bit of compensation for your professional care. That's just my 2 cents. Anybody else?
Well, I think this is good therapy because I have the same issues as she does. And I think a lot of us do. And I'm embarrassed to admit it. And I appreciate you for sharing that story because I can relate 100%. I'm constantly adding people on and wondering if I should bill them a visit or just put in that MRI order for them, whatever it is. So thank you. And I need to do a better job of appreciating the fact that my time is worth it. And so is yours.
Agreed.
And I will add on to that and just sort of, this is making me think about sort of the imposter syndrome a little bit about, how much do we really belong? How much do I really know? There's somebody out there that knows it better than I do, or would do it differently, or would do it better. And I think it is really a struggle. So yeah, I appreciate that story because it's true. You spend a lot of time figuring out, no, I think I just need to bill I'm not going to feel good if I don't. So let's just do that.
All right, this leads me to my next question. It's a pretty good segue into it. How do you tap into the qualities that are stereotypically associated with the female sex? For instance, increased empathy, accessibility, less threatening, better communicators. Is that fair, or is it not applicable for women in medicine?
Well, I feel like we need to hold men to those standards, right? And they don't feel like they need to be held to those standards. So I certainly feel like I need to be more accessible and more empathetic, not only with my patients, but with the people I work with. So what is female dominated? Our workforce, our nurses, our medical assistants, our lab techs, our x-ray techs. So we have to get along with them as if we're their equals, even though we're not their equals. So it's this delicate balance of I'm your superior, I'm your boss, yet I have to be chummy with you so you don't call me the, BITCH doctor when I'm, walking away. So the women in our office are afraid to ask the orthopedists or the other men in the office about, writing a script for an antibiotic for the UTI they're getting or something they're embarrassed to talk about. It always comes to me. Or, we have a walk-in clinic. If they're afraid to ask somebody, they know they're going to say no. They come to me because I'm always going to say yes, because it's harder to say no and explain myself. So I feel like we feel compelled to be all those stereotypes, but I feel like men don't feel as compelled. And again, they're more easily saying no.
Anyone else want to piggyback on that one? Was a great answer. Kind of leads me to another good question. So, what superpowers and or advantages do you think that women in medicine have compared to men?
In reference to the previous question, I think something that might be seen as a negative can also be our superpower, right? The fact that we can empathize more and that we are, especially I feel like now being a mother, I can really empathize more with my mothers, whether they're coming in with their children or they're coming in for themselves. And I get a different level of connection with those patients than I did before I had children. And I think that to me has been a really satisfying part of the practice, is just being able to really empathize and truly be in somebody else's shoes, because you are actually in their shoes too. And that has led to such better patient interactions. And I think patients are more satisfied. I come out of those much more satisfied. So those same things that might be considered weaknesses that, maybe other people don't really, maybe we spend too much time or maybe we're too soft, but I think that allows us a different perspective that helps us to connect better with our patients and ultimately have better outcomes.
I couldn't agree more. I think it's very interesting, and I'll just speak to my own question. Nothing like answering your own questions. So I'm an endocrinologist. I'm not a primary care person, and yet I have a lot of patients I've been seeing for a very, very, very long time. And let's take, for instance, a type 1 diabetic. So they kind of think of me as their primary care physician. So I'm running their insulin pumps. I'm seeing them pretty frequently. And whenever they have any problem, I'm the first person they call. And it's just been really interesting over 30 years of practice, how having those relationships with people, I'm continually floored by what people very kindly say, which is, I tell you everything. And then they say in distinction that they don't tell anybody else everything. And I don't know what that necessarily means, except for they obviously, I'm flattered and I'm honored that they communicate whatever it is that they need to communicate as a patient to me as their caregiver. And it's just a lovely relationship that, I don't know if it's because of my female superpowers, which I definitely think we all have on this podcast. There's something about my practice. So I happen to have 2 female partners, and for whatever reason, all of my employees are females. And it's just remarkable what we hear about different practices vis-a-vis our own and how comfortable people are. And to your point, Dr. Rahbar, how people share more and seem to be more satisfied with their outcomes. But it's just a different relationship that we seem to have with these lovely patients.
I think in my field, I always go the extra mile and consider outside influences into people's complaint. So, the 40-something-year-old woman who comes in with neck pain, X-ray is normal, MRI is normal. Well, why do I have pain? Well, tell me what's going on in your life. There's stressors. There's a lot of tension, pressure, all that stuff in those upper muscles. So sometimes it's like, you don't need an injection. You don't probably even need physical therapy. You probably need a vacation or at least a good massage. So as many a times I sit down and I actually have a good conversation with these patients and they end up in tears and everything comes out. So a lot of times it's the lack of intervention and just listening and just guiding them and giving them an ear is treatment in itself.
Active listening. Dr. Lake, that's your field.
Yes, it is. And fortunately, most of us trained in that. But I do think that there is something about that, women as in a gross generalization, but just as the carers, as the nurturers, as to the more extreme, which isn't as healthy, the people pleasers. And I think to a certain extent, it does sort of allow us to, or me at least, to be thorough, to be meticulous, to try, am I doing everything that I can, for this person, for this situation? And I definitely think that, lots of primary care and Dr. Darr, all the things that you're doing have just a lot to do with stress. And in psychiatry, it's the biopsychosocial model. And we're talking a lot more in women's mental health about menopause and about all of how that's just a confluence of events, physiologic, environmental, family, all kinds of things that are going on that we are really all rolled into one. And yeah, the active listening and compassion and being able to get it out is really, really helpful.
We'll be right back after this.
If you are a physician or an administrative professional working in a medical field in South Carolina, we invite you to consider joining the IndeDocs membership. Members have access to exclusive resources and networking opportunities and are an essential part of supporting our mission to preserve, protect, and promote the practice of independent medicine. For more information, please visit our website at IndeDocs.com. That's IndeDocs.com.
So I'm going to veer off in a different direction, and I am going to ask something a little dicey. So we've all had patients who can get rather cozy, shall I say, in addressing their female doctors. So how do you balance your right to respect with your patient's desire for familiarity?
This happens to me a lot. And I don't know what the correct answer is. You could put your feminist hat on and you could correct everybody and you'd give yourself a full-time job trying to correct most of these older gentlemen. Or you can, get upset about it and refuse to see these people. I don't know. There's all kinds of things you can do. For me, my default is humor. I sort of backhandedly dish a joke back to them that probably might not be the kindest, but with a little giggle and a nice, pretty smile, they'd giggle too, and they usually don't say it again. So I definitely default to humor. It happens a lot. Sometimes it's really uncomfortable. There's been very few times where I'm just like, we just need to get that guy out of this practice, but it happens all the time, more than it should. It's really unfortunate, but it is another hidden burden about, with being a woman.
Well, fortunately, very, very rarely have I been in any situation that really felt dangerous, right? And the one time that I ever was in a situation where something was very overtly inappropriate, it was directed at one of the nurses in the room, and immediately it was addressed, called out, stopped. The visit was discontinued. In general, though, I would say I diffuse it and move on. I have worked in settings where the majority of my patients are older men, and the terms of endearment can be vast. I have frequently had patients say, like, oh, I haven't been naked with a woman in ages, or I look forward to this. So, it's rough, when you're doing skin checks all day, every day, these things happen. And, for the most part, it's diffusing the situation and moving on. I was a bartender for 6 years before I went to medical school, and I tell you, that was some good training in the area of diffusing inappropriate comments and moving on. But yeah, it's an issue that I like you said, Dr. Waring, I don't think there's a woman in medicine who hasn't had this experience.
Well, it sounds like we're using some of the same armamentarium, which is humor.
The only thing that I would add to that, and I think as being a petite and Asian physician has certainly not helped me in this regard, but I mean, over time and as I become less young, these things really don't bother me. The only time that I get very defensive is if it happens to my nurses. And I know that sometimes we talk about how male and female physicians get treated differently. And I do see that our staff, including our nurses and our front desk, they sometimes get treated differently from how we get treated as physicians. And when there are usually older males who treat our younger female staff, I do get very defensive. And I've had times where I will speak up, and I'm not one to be confrontational and say things, and I wouldn't do it for myself. But yeah, I've spoken up for, it's like I feel very protective of my staff.
It's very interesting to me that what you're saying is you wouldn't do it for yourself, but you would do it for others. Dr. Lake, would you like to make a comment here?
Don't diagnose me. I'm not ready for that.
No diagnosis. It's just, I really do. I think it's just so interesting because I'm on the board of Postpartum Support Charleston, which is an organization that is helping to bring awareness and provide resources for women with postpartum mental illness and depression, anxiety. And it's so interesting because we will do things for our kids and for other people that we wouldn't do for ourselves. And I don't know what that's about. I mean, I'm even thinking about the specialty that is supposed to be for women is primarily for women when they are pregnant. The gynecology part is feels like it's sort of secondary in some ways, where the main focus for women in obstetrics and gynecology is obstetrics. And the rest of it just sort of gets lost and, gone by the wayside a little bit. And so I think women, we are not stepping up, I think, as much as we need to with that, kind of confidence that we're here, we belong. And there's a lot of socialization, I think, that occurs to kind of ensure that keeps happening and that there is pushback when we try to make changes. And, I think the idea of women standing up for ourselves is a really important one. And thinking about, why don't we? And again, there are a lot of systemic reasons for that. But I think as individuals, too, what is that? What are we saying?
Yeah, I think we all need to give ourselves permission to apply oxygen to ourselves first on the airplane. Thank you for that. All right, ladies, you've had so many wonderful points today. I wonder if you can tell our audience what your favorite and effective tricks for managing time, energy, sanity. Tell our listeners your tricks.
I'm all ears on this one.
Oh, I was waiting for you to ask the question.
I think that when my kids were young, it was a no-brainer. I finally hired au pairs because of my husband being gone 8 months out of the year. I needed another adult that was living in the house for last-minute things, just to have another set of adult hands on hand. So it was great to have that in the house. As the kids got older and I got sick of managing 25-year-old women who were more interested in their device than interacting with my children, I, stopped getting au pairs. And then everybody's like, you need a house manager, or you need somebody to do this, hire that. And it gets to the point where you're like, I manage people at work. I manage myself, and I don't want to manage another person. I always joked that I needed a wife, but it's it's hard. There isn't a good trick, and I'm not good at hiring things out and delegating or anything else. So my trick is just keep yourself healthy and do it all yourself and never do anything else fun. But it's not an effective tool. So I kind of jokingly say I'm all ears, but I'm all ears. Tell me your tricks, ladies.
Yeah, Dr. Darr, first of all, you're already fun, and so we're not buying that at all. But I mean, I imagine that you have perfected the art of brushing your teeth simultaneously with administering Tylenol to a febrile child, et cetera, et cetera. So, like, you're the multitask queen, right?
Oh yeah, one-handed diaper application. I remember that. Yeah, while breastfeeding. Oh yeah, bending over the changing table for once, being tall was something good.
Wow.
Yeah. Oh yeah, I can
That's a
do it all.
visual.
I'm
We got
definitely
the visual, everybody.
Oh, yeah. Physically, I can do it all until I can't. I mean, I think I told you guys a story before that my back went out when I was on this awesome vacation with my children. It was literally 14 days long, and about 10 days in, I was to the point where I could not stand up straight. I couldn't walk. I couldn't do anything without writhing in pain. And I treat people with back conditions. This should not be happening to me. But again, when I ask people what else is going on in your life, the stress, the pressures, trying to, give your kids who are on vacation every day of their life a vacation. So it's taking your own advice, number one, that's the best trick, and then making time for yourself, which I don't do, and I need to do a better job of. But from a organizational standpoint, I'm in a rhythm, and when I'm off of my rhythm, when I get to bed later than my 8:39 time, I'm off track. So, and then the older I get, the worse it is. And I'm sure I'm perimenopausal now, and the brain fog and everything's setting in. So I need a better system, better than having 3 different calendars with alarms going off.
That's great to hear. Just hearing you made me think of a book that I've recently read called The Body Keeps the Score, New York Times bestseller.
Oh, that would require time to read. And now that I'm sort of rambling here, I think of the other good resource. That's being in a neighborhood, in a community with other mothers, with, kids' moms that are friends, and having a solid, like, go-to person on your street, in your neighborhood, that you can have come pick up your kids or ride along, ride sharing, all the things, carpooling. I depend on the women in my community for sure. I'm not a big social media person, but it's definitely useful. I use Facebook. And so, like, we have our neighborhood moms group. So you kind of weed out the nonsense. And then, just my kids starting to play sports and be involved, and then meeting their parents on play dates. That is one trick, in your contact list, Susie Smith, so-and-so's mom, and write any details you can on their contact, because you can't remember everything, which I also is a good trick, which I'm sure all of us use in our progress notes. Just write one little personal thing about a patient, and then you bring it up every time, ask about their cousin Susie that got diagnosed with cancer, whatever it is. They think you hung the moon, and then it really makes you sound more empathetic. So the same thing with contacts. You just have little reminders all over the place, so you just don't forget, and then it makes you look like you have superpowers.
That's fantastic.
My short answer would be just say no. I really don't overschedule myself. I don't do a lot of, whether it's, I try to do not for meetings, social, whatever that might be. I try to let things happen organically. The things that we have to have done, I make a list, and I have a little booklet. And so I know that those things have to be accomplished, whether it's prescriptions for patients and things like that. But the other stuff, I try not to put it on my schedule. I try to keep my Google Calendar as clean as possible, but not always. And that gives me that organization allows me to think better.
When I had my first baby, my husband came home one day with a big calendar, a dry erase board calendar, and he put it on the wall and he said, "This feels like we're going to have a lot of things to do. Like, let's write down things so that I remember what's going on." And so we started filling in the calendar with all the things we had that month. And at the end of every month, I take a picture of the calendar before I wipe it off and fill it in for the next month. And I have just done this for 14 years. So at some point one day, I could look back and make a photo album of the absolute chaos of every month for my children's entire childhood. And it's all on there. And that calendar does help our family a lot.
I think all of that is great. And it was making me think about the idea of, sort of lean into your strengths. If sort of that organization and having that rhythm and that routine, really, really works, then that's great. and knowing where you're not so good so that you can figure out where you need a little bit of help and being realistic about it. When one of my girls was in kindergarten, I was late to pick her up. She was the last kid there. She was upset because it was, her first day of kindergarten. And I got down on her level and I said, honey, mommy will always be here to pick you up, but I'm going to be late sometimes because that's the way that things kind of go in my world. And for me, that was an acknowledgement of and a sharing with her of, I get it. I know you want something a little bit different right now, and I'm always going to show up, but I know that time is not my friend. And so just being honest about that for me, and that I'm not going to be your room mother. I got a lot of other good skills. I got a lot of other things I can do well, but I can't be room mother. That's a little beyond my capacity. So, kind of I do the things I'm good at. I try to get help with the things I'm not. I try to be kind of gracious and compassionate when I'm not, and not feel like I'm a, bad mom because I can't be room mom. And finding your village, finding your people, finding your community, both in medicine, in mom life, in couple life, I think we don't reach out enough, and we don't sort of maybe realize how important that community is for us. But I do think it's essential for women in a way that is different for men.
Perfect. Thank you for that. Now for one of my favorite questions. Everybody's ready for my favorite question. What would you tell your younger Dr. self that might smooth her future path?
Younger Dr. Self would have said, hey, don't sweat the small stuff. Life is too short. I did read a book one time. It was called Die with Zero. And it was basically like, financially, why are you saving your money and not spending it on opportunities? Because you physically peak at age 45 as to the ability to travel and do all the physically demanding things. So spend your money on your kids when you need it. Spend your money on yourself when you're younger, and with the goal of dying with zero. So you've already given it to your kids when they need it, not when you're dying and they've probably already made their own money. So that book was a wake-up call for me from a financial standpoint, because we go through training and we don't really have any money. We live off peanut butter and jelly so long, and then we get to be attendings and we're making good money, but we don't know how to spend it. We don't know how to use it on ourselves. So from a financial standpoint, I would go back and tell my younger Dr. self to enjoy those times that you've got a little bit of money, you've got time, you don't have a family or a husband or anybody else to take care of. So enjoy your time when you're younger, because when you're older, you're going to have all these stressors and all these things. You're going to have more money to spend on yourself, but you're going to have less time.
I agree with Dr. Darr 100% that 20 years ago, I tried and wanted to be everything and do everything. And then you realize that in our whole existence, at least that we know it, time is our only non-renewable resource. And it really took us stepping away from our lives and taking a sabbatical time to realize that there are really only a few things in my life that are that important, and everything else can come and go, and it doesn't really matter. And so as long as those few pillars are intact, and there are things like family and my own integrity and, other fun things like that, but the rest of it just doesn't really matter. So, my house is kind of in shambles because we rented it out for 2 years. That's okay. We'll see what happens, so just letting a lot of that other stuff go, and only finding things that, find the things that make us happy. And it's okay to do those things. I think I tried for a long time to fit a specific mold that we felt like this is a 25-year-old young female physician, and that's what she should be like. And that's what I was trying to be like, as opposed to just do what you want to and do what makes you happy. And that's going to bring more joy to yourself, but also the others around you. And you're going to create your community based on the people that you love and what you want to do, as opposed to trying to be somebody else that you're not. And they're never going to be, maybe.
So for me, if I could go back to my younger self in medicine, it's a similar theme, basically sort of optimizing my time management and sort of maybe having a little bit better perspective on taking care of myself and my family I often say when I talk to the medical students and the residents that I've mentored over the years is that when I was an intern, I had my first baby, and when I was a fourth year resident, I had my second baby, and I took so much pride in how hard I could work. I never took a day off. I never called out sick. I went a week past my due date in both pregnancies, and I still kept working. And with my first child, I went back to work after 4 weeks. And I took so much pride in that. Like I'm, look how tough I am. And now in hindsight, gosh, if I could do some things different, I certainly would not have done that. Hindsight is 2020, but work-life balance, prioritizing your mental health, and yeah.
Perfect. And that's a wonderful segue to our last answerer of this question, mental health. Dr. Lake, what would you tell yourself, doctor?
I think I would say that you're okay. What you're doing, how you're doing it, the choices you make, it's okay. You are making the best decisions you can with the best information you have, and you're okay. I guess I feel like I felt like things needed to be done a certain way, and we were, you're young, so you're wanting to meet somebody, have a family, and those things feel, and have a career and make all those right decisions, and it feels so important and so urgent. And I don't know that I could have known it then, but feeling like I'm maybe on the other side of that, and you're okay. Everything you do is okay. Being good enough. You are good enough.
So now I want to hear, in your past, is there something that you've done that you're particularly grateful for?
I think I would say choosing psychiatry. I did not intend to go into psychiatry. I thought surely I would do pediatrics, surgery, or OBGYN. Could not manage the schedule with surgery. I needed to eat more frequently than they did. It was just, the timing was off. So it's allowed me to make the schedule the way that I have needed it to be and wanted it to be. And it just clicked in medical school, and everybody could tell around me, and I could tell. I was like, yeah, I guess I gotta do that one.
I'm glad that I took every opportunity when I was younger to travel the world. So I told myself early on, I grew up in Illinois. I didn't see the ocean until I went on my college recruiting trip to South Carolina. And so now I love the ocean. And I said, I'm never, isolating myself again, and I'm going to show my kids the world. So, I studied abroad on my athletic scholarship in undergrad. So I was in South America for 3 months. And then in residency, I got to sail on the semester sea ship and take care of the kids. And I saw Asia. I backpacked with my husband before we had kids. So I did all those things, when I was younger, when I had no money, on a shoestring budget. But now there's not as much time to do those things. And I'm just kind of tired, and I don't have that drive anymore. So I'm glad that I traveled and did fun things when I was younger, before starting a family and before starting a career. Yeah.
There are other people in my life who would look at some of my other career choices and say, I told you shouldn't have done that. But then my counter is always, then I would not have had this chance to get to know Dr. Mazza and the way that we did and work together. And it wouldn't have led us here to where we are today. And I would not do this with anybody else in the world. And I would not do it by myself either, starting this whole venture at this stage and age of my life. So yeah, so I think that's something that I would say that we did that was right and good. I would also say, if you're for a younger physician, take off lots of time. I took a year off before med school and traveled, and it was amazing. And I would never undo that. Also taking a sabbatical.
So I also was going to say, the partnership that I have with Dr. Rahbar has been amazing. And, along with that, just choosing the people that I have chosen in my life, I feel so grateful. And I know this is a podcast about women empowerment, but I'll tell you, my husband is like women empowerment. I chose a great husband, and he has been my cheerleader on my life's journey, whether that's, motherhood, career, starting a business, whatever I bring to the table. Like, I think I want to do this. He's like, you can do it. I'm here for it. And I think it is really important to choose a support system around you that loves you and is there for you.
Agreed. Well said. So, ladies, you're very competent, seasoned pros. How do you refill your cup, and what are your guilty pleasures?
I would say being with my friends. So I enjoy playing tennis a couple of times a week. And the friends that I've made through my fertility work that I did, I've known them now for 20 years. And so going to a conference once a year, just I get my intellectual stimulation and I get my friends all in a really compressed time, and that holds me for several months. I've enjoyed yoga. I've been doing a class consistently since before COVID, and recently did a retreat that was like amazing. So those things are my fill up cups. The guilty pleasure, if I've had a bad day, I would sit and binge watch TV, science fiction stuff for like hours, Star Trek kind of thing, crazy stuff my husband doesn't care about. Like, that's fine.
All I want to do is go play beach volleyball. So that's my, and I usually play Friday morning, Saturday morning, Sunday mornings. I've got, a different group on each day that I play with. If it's not raining, if I haven't hurt myself, when I miss those days, I'm a mental wreck. And then I also, always tell people what to do, and I never take my own advice. I own a red light bed, and I tell people, get in the red light bed, all these things. And I was like, wait a second, I own a red light bed. So I drop my kids off at school, and I go and I lay in that bed. It's 12 minutes. It might be, placebo, but I feel so much better because I don't want to have to take Lexapro again. I've been on and off it, and it definitely helps, but I want to naturally be able to be ahead of myself, and that's what I need to do better. So I guess I don't really have a guilty pleasure. Everybody keeps asking me that. And there's nothing I like to spend money on. I don't have handbags. I don't get facials. I don't wear jewelry. Like, I don't have anything like that. But exercise, I love competing and exercising. And I wish I had more people to do that with and more time.
So if you want to exercise, we do yoga. So if you want to ever come, we do 6 a.m. yoga. So that might actually fit your schedule.
I like when you say,
if it was 5
I'm not
a.m.
involved in that. So and I do a lot of things together, but I'm not part
Let's
of
be
that.
clear. I'd love to try yoga.
No, I'm like, for real. So I guess on that, my happy place is yoga. And when in my 18th, I've been doing yoga, like going to classes for 20 years. And then when I had my sabbatical, I actually did not one, but 2 yoga teacher trainings because I'm crazy. And that's like, I know it sounds so crazy, but it's like changed my life. And so I recently started teaching. They're just my friends. We have a running group that we meet a couple times a week. And so I started teaching yoga to my running group, and it's my happy place.
Oh, I'd love that.
It's been great. Yeah. And then on the other flip side, it justifies me eating bars of chocolate. Oh God, Trader Joe's is the worst. They have these mochi crispy things that I'm addicted to, like legit addicted to, that I cannot buy because if they're in the house, I will eat them all. And they're a chocolate cornflake bar. Also, this is like a Trader Joe's commercial. But yeah, no, never go to Trader Joe's. But if you go get the mochi crispy things and their chocolate bars. I blame Dr. Mazza for that one. I didn't eat their chocolate bars until we started getting those in the office.
I need to try those too.
It's so good.
Lot comes with partner.
Oh my gosh, you guys, I have so many bad ones and very few good ones. Sadly, I'm trying to switch it. These are my absolute though, without question. Okay. When my healthy recharge is I love to read. I love bookstores. I love libraries. So I will sometimes sneak away after work or something and go to a bookstore, and I locally owned ones, and I will just sit and read in a corner. And so anywhere I can go to read quietly, that's the recharge. And my bad one, you guys, I am addicted to Sonic mozzarella sticks. If I had a bad day, you will find me in the drive-thru. I will hide in my car and eat them like this so that nobody sees me. And it's a real thing. And if I've had a really bad day and I can't get to Sonic, then I go to Arby's, and that's disgusting, but it has happened.
I love Arby's. Yeah, when I was pregnant, that's all I wanted was roast beef sandwiches from Arby's, and they were renovating that one in Mount Pleasant. I was so mad.
Oh my gosh,
if you ever see me in the parking lot there, I'm going to be mortified. Just don't look.
You're not here. I'm here. No,
She'll
I'm
be
here.
there too.
That's awesome.
Dr. Waring.
Let's see. What do I binge on? I binge if I need it. How about reading British mysteries? Oh my God, how boring. Or I'm kind of a gardening fool. So if I get my hands in the dirt and I start doing something, I love gardening. My dahlias, my peonies, my you name it. I'm gardening.
Wait, you can grow peonies down here?
Girl, I grow them up in North Carolina.
Okay.
I go to the mountains and I retreat into my house and I listen to hummingbirds and bears and look at the sky, and I call that cowboy TV because the clouds move like I've never seen before, and it is so breathtaking. And truly, I will be out on my deck and I've got hummingbirds flying all around me. I literally hear the bears come and go. And they make these, I'm not going to actually make the sound on this podcast, but anyway, the bears make their sounds, and it's transformative. You can't be sad when nature is overwhelming and you are just at peace. It's a beautiful thing.
Amazing.
I think it's a great way to end this podcast. But before we do that, for listeners, if you have one takeaway from this podcast, what is your takeaway?
There's a small saying that helps me when I feel like I'm in the struggle. And I guess my one takeaway would be that if we're always looking at the past, then we're always living in regret and maybe depression over what has been or that no longer is. And then if we're looking into the future, then we're looking for anticipation. Maybe we're feeling feelings of anxiety. So what I try to do, not always successfully, but it's just trying to find some joy in the present moment. And maybe that's not where you want to be, and it's not where you thought you would be, but that's where you are. And so trying to find some satisfaction and some joy in that present moment will help you a lot in a long way.
When I was a new mom, my sister-in-law, who's a radiologist, gave me some advice, and she said, there's going to be times when you're a great doctor and there's going to be times when you're a great mom, but it's probably never going to happen at the same time, and that's okay. And I have thought that millions of times, and it's really helped me.
I think I would say follow your instinct. I think do the things that feel right, that make sense to you. Our bodies and our minds know when something is not working, and paying a lot more attention to that, and kind of knowing that you're good enough. You're doing a pretty good job, and things will work out, not necessarily the way you think they will, but you're still on the right path.
I would say being a woman is difficult. Being a mom, a wife, more difficult. Being a doctor, a mom, a wife, all the things, so difficult, but I wouldn't exchange it for anything in the world.
That's fantastic. Well, I'm really enjoying our podcast community today, and I thank every one of you for all of your insight and your wisdom and your participation, and truly, it was a pleasure to have you today. Thank you.
Thank you for having us.
Yeah, this was great.
Yeah, thank you.
And to everyone listening, thank you for joining us. Please make sure to rate and follow the podcast, as that really helps us to grow this community and spread the word about the issues we've explored today. And please tune in next time for another great discussion about independent medicine in South Carolina. From all of us at IndeDocs, take care and stay well.
Thank you for tuning in to this episode of the IndeDocs podcast. Our producer is Jenna Leaf. Promotional support by Uplift Marketing. Mixing and mastering by Noah Martin. Content editing by Jenna Leaf. Additional production support by Noah Martin, Rebecca Lockhart, John Robinson, and the IndeDocs Board of Directors. For more information, please visit us online at IndeDocs.com.